Hi, everyone. Good afternoon, and welcome to the Mobile Health Program webinar series for Fall 2020. It sure feels like fall out there in this nice, beautiful weather we're having. We hope everyone's doing well today. Thanks for joining us as we kick off our new 6-week series for Fall 2020. So I'm Noelle Duckworth, and so those of you that were able to join us over the summer, you might have seen my face at the beginning of those webinars as well. That's because I work here at the University of Delaware with the Partnership for Healthy Communities. We're a community engagement initiative. And the partnership is the overarching entity under which the mobile health program operates out of UD's end, and our other partners can share their. Our director at the partnership is Rita Landgraf. We have our associate director, Erin Knight. I'm Noelle Duckworth, the coordinator. Paulette Hussey-Caston is our admin specialist. Christine Sawinski, who's here with us today, is our mobile health program coordinator. We have Kate Dupont Phillips with our Healthy Communities Delaware initiative. Okay, so who are all of you? So we know that we've had a nice response. I know we have a large amount of community members and partners joining, almost 2/3 of our audience, and about 1/3 of our audience, or 31%, identifies UD faculty or staff. So thanks for taking time in the middle of fall semesters and busy schedules for all of you to join us today, or those parents out there that are helping their child remote learn, and you're also joining our webinar to get supported in that process. So really multitasking, but hopefully it'll be a great benefit for you moving forward. Thank you. So some technical details. Our audience lines are muted for these webinars. They will remain muted, but you certainly can talk through the chat function and say hello to folks or share information or resources. And also, if you have questions for any of our presenters, though, we do ask that you make sure you put them in the Q&A box, which is there at the bottom of your screen. You can see the little folder. Click on that, and you can type in the question. And then when it's time for the panelists to answer audience questions, we will pose them. If you have any technical issues or can't hear us, please let us know through the chat box. And today's webinar is being recorded. It will be made available for viewing after today's presentation. So if you get called away to help with that remote classroom learner or have anything come up, don't fear, we will have this recorded. You can check back at another time if need be. We will have it on our Mobile Health Delaware website, and Christine will share more details at the end of the webinar on that. You'll also get an evaluation that will be mailed to you following the event. Please just take a few minutes to fill that out. It really helps us out, especially as we launch a second webinar series for the fall. So thank you so much. Christine, I'll turn it over to you.
Great, thanks Noelle. And thank you all of you for joining us today for our first webinar in our Fall 2020 series. I'm Christine Sawinski, Project Coordinator for the Mobile Health Program, and I'm very pleased to be part of a collaboration to bring mobile health services to Delaware communities while building workforce development for University of Delaware graduate and undergraduate students. I am hopeful that you will be able to join us for our other webinars in this fall series, which will take place on Wednesdays at 2 p.m. We are also offering a Lunch and Learn series, with the first one being offered next week. Please go to our website to register, which you can see here on the slide is our domain name. Also, it is my great pleasure today to introduce you to our two presenters. Our first presenter is Dr. Sandy Gibney, the Medical Director for the Mobile Health Program, who will be offering us facts and myths surrounding COVID-19. Dr. Gibney will be answering questions surrounding her presentation on COVID, following her presentation. So please, again, put your questions in the Q&A box. Also, Sandy, along with two of our UD nursing students, Kristen and Shannon, are out in the field today with our mobile health van, serving and treating our community. Thank you, ladies. Our second presenter we have today is Dr. Brianna Hout, who will be presenting on parenting during the coronavirus pandemic. Dr. Hout is an associate scientist in the Department of Psychological and Brain Sciences at the University of Delaware, who will be, again, presenting on parenting during the coronavirus pandemic. And Bree also will be Bree will also be answering questions following her presentation. So again, thank you for everyone for joining us today. Please join us the following weeks in our webinar series, as well as our Lunch and Learn series that begin next week. So once again, it's my great pleasure to introduce you to first Dr. Sadney Gibney, and following Sandy will be Dr. Brianna Hout. Dr. Gibney, thank you.
Thanks, Christine. And I appreciate this opportunity to share a few minutes with everyone here. And as you can see, we are currently on the mobile health van, which there's my students. That's Kristen and Shannon there. And there's my other providers. But we're actually here at Noble Community Center, and we're providing mobile medical care as part of the project for the UD partnership, which is an amazing project that we've embarked on to provide care for those that may not have a medical home or be uninsured or underinsured. So we have had this program in place 6 months now, and it's going great despite COVID. I asked you all to submit any questions, because sometimes I find the questions are more informative than what I have to say. But I was asked to briefly talk about some of the facts and myths around COVID. And I want to start out by saying simple facts. How is it spread? It is spread most likely by aerosol person-to-person contact, meaning coughing, sneezing, being in close air contact is the most likely form of spread. Where does this virus live? It typically lives in the nose, in the nasopharynx, and then it drips down to the back of the throat and inhabits then the type 2 pneumocytes in the lungs. Now, typically, how is it spread? It's spread most commonly through the nose, inhaled particles that are aerosolized or suspended in the air around us. It's inhaled through the nose, but it also can enter through the mouth, not just from like drinking or eating after someone, but actually it can be inhaled from just, we all breathe air in through our nose and mouth. And unfortunately, we oftentimes use our hands to touch surfaces, and then we touch our mouth and we touch our nose. So that's one of the reasons why masks are always very important to wear, because not only do they stop outgoing viral particles and trap some ingoing viral particles, but they block us from touching our face, around our nose and a mouth. And finally, the third portal of entry is through the eyes. Now, right now I have regular eyeglasses on because I'm old and I can't read without them, but typically when we're out in the field, and there's some pictures I think Christine has of us out in the field, we're wearing either goggles or we're wearing a face shield. So when we're seeing patients here, we have a face shield on or goggles, and with our N95 or 2 surgical masks. And that's sort of our standard of care, because we want to try to avoid getting any aerosolized product in our eyes, another portal entry. So the nose, the mouth, the eyes, most commonly. Initially, they were concerned about whether or not there would be a lot of contamination off the surfaces. We know that it can happen, but is not as virulent and likely as getting it inhaled through those orifices of the nose, the mouth, the eyes. It can be live briefly on surfaces and up to 24 hours, but we do know that those viral particles are probably less infective than those that are suspended in the airspace. So the concern that I want to mention about COVID has been that up to 20% of our positive tests have been patients that have, or people that had no symptoms, 0. So up to 20% of the people are what we call asymptomatic carriers or super spreaders. They can be because they have no symptoms whatsoever. Most of the time when you have influenza or bad virus, you feel lousy, right? You ache, you have a fever, you're coughing, you're congested. 20% of people with COVID, especially those that are otherwise healthy in that age group between, say, 16 and 30, with really good intact immune systems, they don't typically have symptoms, although they can get very sick at times. And that's a whole different story. But in general, that's what's made this very difficult and challenging to stop the spread, is because of that. And that's why masks, hand sanitizer, and social distancing, at least 6 foot, is very important. Talking about tests for COVID, the best tests can be broken down into blood tests and specimen tests, swab tests. The blood test we typically don't do. We started out thinking we were going to use that, but right now we rarely use it to measure the immunoglobulins in your blood, IgM, which is released initially when your immune system sees a foreign invader, and then later IgG, which is a more persistent antibody or white blood cells that will protect you persistently and hopefully recognize a second strike with that virus and not and be able to recognize when you're invaded and then be able to fight it off on a second. And that's where we talk about convalescent serum to help people that are trying to recover, but their immune system does not mount a response. So those blood tests are ordered, but very rarely. More likely what we are going to be doing and what we've done the most of is swabbing the areas where the virus lives the most, which is a nasal swab or posterior pharyngeal swab, the back of the throat. And the preference on these is the nasal is probably the most accurate, most likely, if it's done properly, to get a positive test if it truly is positive. And then the second best category on that is the posterior pharynx, not because it's typically where the virus lives, but it drips down the back of the nose to the throat, and a good specimen there will pick up the virus. And then we also, those are the two swab tests we use in addition to a third one, which is a saliva test. You kind of like brush your gums and try to get enough sample there. The virus typically doesn't live a long time in around your gums and mouth, and that test can be affected by whether or not you ate or drank anything, and so sometimes that's a little less accurate. So those are the tests that you'll see. And then the final one, and those are all based upon one simple thing. Those tests that I just mentioned, those swabs are looking, it's a PCR, polymerase chain reaction, looking for fragments of the RNA. So the COVID-19 has a specific chain of RNA cupules, if you will, proteins that make it up. And so that test is trying to recognize those proteins and match it as present, and then it will toggle positive. And then finally now, the rapid tests that we have that can give you a result in 15 minutes are based upon an antigen, which is an antigen is basically a protein, and the coronavirus that looks like a big sunburst, but those little tentacles that look like octopus tentacles at the end of them is a protein. And that's how that little protein attaches to your cell. And that's called a spike protein. It attaches to your cell, specifically the type 2 pneumocytes in your respiratory tree. And more specifically, the ACE inhibitor receptor, which is present. ACE meaning angiotensin converting enzyme is the name for the ACE receptor that we know that spike protein clings onto and then binds. So that antigen test is still a swab, but you can get a result in 15 minutes. And down at the university, we've been providing tests through the Newark emergency room in 15 minutes to recognize that protein. So those are the three kinds of tests that we have. And I want to just briefly talk about what are the most risk factors for getting a sick disease or getting sick. Obviously, we've had everyone from an infant to an elderly person that has gotten sick with COVID, but the studies have shown that there's certain more people that are more likely to get sick, those that smoke and those that vape. If you vape, you have 5 times increased risk of getting COVID. We also know that, why would that be other than the lung damage? But the other reason is that people that smoke and vape have upregulated the number of those ACE receptors where the COVID virus can bind. So if you have more ACE receptors, then the COVID virus can bind to them with their spike protein and be more invasive and virulent. So smokers and vapors, and we found out also folks that have hypertension, that have diabetes, and obese individuals tend to do worse and be more likely. And then of course, with any illnesses, other comorbidities, immunosuppression, such as you're on cancer medications or you're undergoing treatment, or also if you're on immunosuppressants for rheumatoid arthritis or other conditions, those can increase your risk. And then age, because the immune system just wears out. And we do know that the younger folks, although they don't get sick, but when they do, from what we call a cytokine storm or a bradykinin storm, it's when the immune system does its job too well and starts overdriving and creating an inflammatory cascade and making these people very sick because it starts attacking other organs like blood vessels, causing blood clots like the heart, causing myocarditis, which you've heard about some kids that aren't able to go back to sports participation until they get an ultrasound of their heart because COVID has invaded part of the heart. So those individuals can be very well and not have any risk, but for whatever reason, their immune system is hyper intense and goes to town and creates that inflammatory or cytokine storm. And these are things like interleukin 6 and bradykinin that get released. And then, you know, I don't want to take up too much time, but I want to talk quickly about treatments and then hit a few myths. Treatments right now, one thing that we have found that works, that for people's immune system is unable to mount a response, we will take folks that have recovered from COVID successfully, and we take their blood and find out if they have a high enough titer of immunoglobulin G, right, IgG, and that is specific for COVID, and we'll measure that quantitatively in that person who has recovered from COVID blood. And if they have an adequate titer, then they are a candidate to donate their plasma, which is the liquid portion of blood that's not cellular, with red blood cells. And they will then donate that plasma to someone who's struggling to mount an antibody response to COVID. So that's called convalescent serum, and that's been shown to be very effective. And for those that are in the midst of the illness and are not doing well because their immune system is going berserk, then steroids, in particular dexamethasone, has been valuable. What things haven't really proven to be effective? Hydroxychloroquine, the quinines, used for malaria treatment, thought initially might be valuable, but were not. Azithromycin, a macrolide antibiotic used for many atypical infections, was not found effective. So basically, now we know how it gets in, how we test for it, what are the risks for it, who gets sick, and also what to do when you do get sick. And so some quick myths. Ibuprofen. Recently, when this first started, they said that there's a possibility that ibuprofen could increase your risk of getting COVID and getting sicker on COVID. And that has been proven in multiple studies. Most recently, several have come out that that is not the case. So people initially were not taking ibuprofen or Motrin or Advil as trade names because they were concerned that they would get sicker or it would increase the risk of getting sicker, and that has not bore out. So for those folks that were only taking Tylenol, ibuprofen and those have a little bit better anti-inflammatory effect, whereas Tylenol is just a central nervous system painkiller. And then also people are frightened for flying because we do know being in indoor, closed space, rebreathing air is one of the worst things that you can do, right? So you don't want to be in an enclosed space. Fresh air is the best thing possible, right? But short of not being able to get in fresh air and being outside and keeping distance, when you fly, the airplanes now have gotten very good about recirculating outside air through a HEPA filter, which is a high particulate filter, and then discarding that air that it's been filtered and starting with new air. As opposed to where we are now, we're rebreathing our own air. What I breathe out, I'm going to breathe in again. The airplanes now have designed so that they're bringing air in from the outside, they're filtering it, and then you breathe it, and then it gets sucked out outside of the plane, and then you start breathing new air coming in. So every 20 minutes, the airspace is completely new and different on that plane. The only thing we say about that is that, you know, anytime air travel, it's decreased oxygenation and oxygen tension, so there's a little bit increased risk with that. But as far as air travel, again, I would fly on a plane, but I would wear a mask and I would wear a shield. When the COVID vaccine comes out, and it will, you're not going to be able to get COVID from the vaccine. This is a common myth that I hear people say about the influ. Oh, I don't want to get the flu shot. I get the flu every year. No, you're not going to get COVID or the flu. It's an inactivated protein particle that tricks your immune system into creating an antibody against it. It's never a live virus. The only live virus we've given in a long time was a polio virus, and we're not even doing that. So there's no live virus given to anybody, and most of the times they're giving what we're going to do with these vaccines. We're taking a known vaccine like influenza, measles, rabies, and we're tagging that spike protein onto that known vaccine to add a little giddy up for COVID. So when you get a measles vaccine that everybody gets, there might be a modification of that. A rabies vaccine, there might be a modification of that. There's 9 different companies that are working using a known vaccine, tagging a protein onto it, but that's specific for COVID. So you're not going to be able to get it, but you might feel a little weird because your immune system is giddied up and responding, but you're not going to get sick. Vaccination will not eliminate COVID. Okay. What it does is it creates your necessary immune response. So if I'm in a room with someone who coughs on me that has COVID, it's not going to eliminate transmission, but as soon as my immune system sees it, it will recognize it as foreign and say, oh, I got to get that, and it will kill it. And so I don't get clinically sick, but transmission will still be an issue. So that's why when we're coming up on flu season and we're trying to calm down COVID season, we need to continue with those 3 things: hand washing, mask wearing, social distancing. Very important. And so final thing, talking about surveillance. How do we know where this is and what to do? And so surveillance, we're doing different things. We're looking at the wastewater in individuals because we know COVID is excreted earlier in the feces and urine than it would be otherwise that we could catch a positive test. So there's sampling being done of wastewater. And that has gone on other contagions. It's not a new thing, but COVID we're using that for that. As well, pooled sampling, meaning we take a group of individuals, we swab them, run all those tests together, saving money, not doing 1 test for each person. And if one gets triggered in that big pool of, say, 200 people that we swab, then we're kind of in trouble. We have to go back and figure out which one of those triggered the positive test. But if they're all negative, then we've done 1 test to eliminate 200 people. And so that's good to surveil areas like dormitories or institutions if you're making sure it's not laying dormant there. So that's basically, in a nutshell, in about 15 minutes, what I wanted to say. And I'm happy to entertain any questions. And I'm very thankful to be here today with my students. We're looking forward to this project that Christine has done a yeoman's job, and Noelle as well, and Rita, to create this for us. We're really looking forward to continuing it and providing mobile care for folks who otherwise could not get to us.
Great. Thank you so much, Dr. Gibney, for giving us information today on COVID-19 facts and myths. So we are open for any Q&As that you may have. So please go ahead and send those to us so that Dr. Gibney can address those here in the next few minutes. And then after she presents, again, we will have Dr. Brianna Hout, who will present about parenting around COVID-19. So Sandy, we do have a question here. The question came to us. It says, if I had COVID, can I get it again?
So that's an interesting question, because the question is, did you mount an appropriate immune response? And that is the big question. Oftentimes what happens is an individual's immune system, if they're 100% functioning and does a great job, it eradicates the virus, no viral particles are left behind. And in those cases, we feel like you've completely eradicated the virus and you've developed an appropriate immune response so that the next time you were to see the virus, you wouldn't get sick, you would fight it off. That's in a perfect world with a perfect immune system. The other scenario that can happen is that you fight off 80% of the viral particles, but 20% of the real strong ones, or for whatever resistant ones, remain in your body. And at some point when your immune system or your surveillance system is down or diminished, then those viral particles can start replicating again. So it's hard to determine whether or not you got, most likely we don't think if you have an appropriate immune response that you'll get it a second time in a given season. Because remember, viruses like to mutate from year to year, right? But for this year, COVID-19, if you had, for example, appropriate antibody response, eradicate all the viruses, there's no particles left, the chances of you getting a second bout after you have built the appropriate immune system to fight it off is very, very low. So, you know, some people feel like they got it a second time, but they may not have cleared it completely the first time.
Great, thank you. Next question we have is, should I get retested once positive, and if so, then when?
So interesting, again, in that depends on what kind of test you want to get, a second test, because the concern is a lot of times that second test can remain positive way longer than you're infective. So, for example, if people wanted a second negative test, that might be acceptable, but just to go out and get a second test, depending on what test you got, you may still have a trigger a positive. For example, if you did get an antigen test and you went out today and you still had a few viral particles, not ones that can make you sick or anyone else sick, you have a few, and you got tested, it might still trigger a positive test. Does that mean you're infected? No. You don't have enough viral particles or the ability to transmit it. So typically we do not recommend that people, once they feel better and they've recovered and a period of 14 days has elapsed for those that aren't healthcare workers, and they have no symptoms, no fever, there's no indication that they should get a second test to prove negativity, because they could be falsely misled if they triggered a positive depending on what test they got. But certainly with the antigen test, that rapid 15-minute one, that can remain positive way longer than you're sick or able to make anyone else sick. So not typically recommended.
Great, thank you. This came in, not necessarily a question, but could you address the recent changes to FDA guidelines to limit the spread?
Yeah, so I think this is referring to the CDC guidelines that have made some recent changes. Initially, I think they were recommending initially that folks not get tested at all if they had no symptoms. And I think that's what this is referring to. And that CDC first said, like, oh, if you had an exposure, if someone with COVID was at your house and had dinner with you and then coughed on you, whatever, but you're fine, you feel fine, don't worry about it. You know, don't get tested. That was the CDC recommendation as of about 2 weeks ago. And then they quickly reversed that and said, and quite frankly, honestly, I was in disagreement with that because of being so involved. I've swabbed over 6,000 people, you know, at this time in the community. And so I know how effective this is. So they quickly swapped and said, you know what, if you have an exposure, you have symptoms, yes, get tested. Basically because you don't want to be a super spreader, right? You don't want to be one of those people that's asymptomatic and continues around your merry way and doesn't do the next right thing and mask and go somewhere. So, you know, I think that's what they're referring to is that reversal of if you're asymptomatic and got exposed, don't worry about it. No, if you're asymptomatic and you have a documented exposure, don't be that person. Don't be that 20% asymptomatic spreader that creates all this havoc because you're otherwise well. So that, I think that was the reversal. And I think perhaps it may have related to trying to limit the number of tests that were being done at some point, but that's not the right thing to do.
Great. We have 2 more questions here. At what point do you know if your mask might not be helping protect others? For example, our family uses 3-ply surgical mask and my son's gets wet from sweat. Should he use a new one at that point?
Yeah, so typically, depending on what you're using, if you're using a surgical mask, which is made of a kind of a cotton fiber material, it breaks down in a couple of days. So as soon as it gets wet, the fibers are not effective as filtering. If you have a cloth mask, it needs to be washed or laundered in hot water every couple of days. I don't recommend anybody using a mask more than a week if they're using the, say, for example, N95 or N99. Those are a little stronger mask, and that's what this here is a N9. This is actually an N99, but the ones that are blue cupped, they're N95s. They can go a week, but we don't expect you to use that beyond a week, right? So the N95, N99s, the ones that look like asbestos masks, 1 week. Surgical masks, if it gets wet, you really should start with a new one. And then cloth mask every other day. So we tell the kids going to school, you should come to school with 2 masks. You wear one, you wash one, you wear one, you wash one, right? Because the virus can lay on the surface up to 2 days, and that's the thought behind it. Because what you don't want to do is, let's say I had COVID and I'm like breathing into this, and then I sit it around on the surface, down on the surface, if it's containing viral particles. So basically, if it gets wet or otherwise damaged, you got to change it. Cloth, you got to launder it every couple of days. But those surgical masks, they're not designed to last more than about 24 hours, and certainly not to be sweated through and used again. They're just too frail. So surgical masks or those thin masks every day. If you're using one of the ones that people have created that can be laundered, you need to switch it out, because you'll carry viral particles on it, so you won't protect yourself or others.
Okay.
And then the N95s once a week. They're just more sturdier, and they can actually be sprayed with a little mist to decontaminate them a bit and hold up.
Thank you. And our last question, Dr. Gibney, is does everyone get a fever, even if it is a mild one?
No. You know, we started out thinking that we were going to be able to figure this out real easy by screening people for fever and symptoms. So when I started this, thing, I was in, how do I want to say it? I was brought on to try to stop homeless and people that didn't have a place that they could quarantine or isolate, to get them off the street if necessary. So we went to all those places like Sunday Breakfast Mission, Emmanuel Dining Hall, St. Pat's, St. Anne's, Salvation Army, YWCA, and screened people initially thinking if they didn't have a temperature, they didn't have symptoms, we were good to go, right? And we quickly found out that there were a good deal of people who were positive and had no fever, never had a fever. So the body, in order to have fever, the immune system has to recognize it. It has to send out a pyrogen, which creates the fever. And the pyrogen is what the body uses to elevate the blood temperature, because the virus is very unstable in warm environments and cold environments. That's why it won't live if you have it in the refrigerator. It won't live if you have it in temperatures like, say, if you put it in the oven or if you microwaved it. And that's the other point too. People are now using UV light to kill the virus. It's very unstable. It doesn't have a cell wall. So microwave, ultraviolet light will kill this virus, as will extremes of temperature, not even extremes, but temperatures and high or low. So that's why you can kill it by heating it or freezing it, and that's what your body tries to do by creating the pyrogen response to elevate your body temperature to kill it off. And sometimes it works, right? That fever is a normal and appropriate response of your immune system, but not everybody will get a fever. And so, that's part of that whole asymptomatic problem that we see. But again, fever is not, if you get a fever, yahoo, right? Because it's at this time, if you have a fever, it's probably COVID, right? But you can't whistle in the dark if you don't have fever. You're not off the hook. But if you get fever, very highly likely that it's COVID.
Great. Well, thank you. Thank you, Dr. Gibney, for being with us today. And thank you for all that you do with the mobile health program. I know you're on the van today, not only treating patients, but precepting our students and presenting a webinar to us. So we really do appreciate your time for all that you give to us. So thank you. And with that said, I'd like to now introduce Dr. Brianna Hout, who will be speaking to us about parenting during the coronavirus pandemic.
Hi, everyone, and thanks again to Dr. Gibney. I feel like I just learned a lot. I made a few notes and I'll put a little reminder to wash all of our household's masks tonight. So it was really great and informative to me. So as a kind of regular health or physical health provider, I'm really concerned about talking about behavioral health and mental health during the coronavirus pandemic. And I'm especially interested in kind of learning how the coronavirus pandemic has impacted our parents and caregivers. And I want to spend a little less time talking about all of the doom and gloom around COVID and all the things that are bad, and a little more time towards the end of the presentation talking about how you can create more harmony and happiness during a challenging time and to take care of yourself. So I'm a clinical psychologist and also a mother of a 2-year-old at this particular time. My primary focus in my clinical work is with children and families. So a lot of my presentation is from things I already know about parenting stress and caregiver stress, but there's also some things that are really unique to the coronavirus pandemic that I want to share with you and get you kind of thinking about your own experiences. And then at the end, we'll do a Q&A, and if you have specific questions or something popped into your mind, I'll be happy to answer them. And I also want to provide a little bit of information on resources that you might want beyond this presentation, and also some of what Delaware has right now if you feel like, hey, maybe I need a little bit more than just learning about what's going on, or I need some support in the home. So those are our objectives for today. So you can go to the next slide. I wanted to first ask a poll and just sort of get a sense of who here is actually a caregiver of children or adolescents right now? And that could be personally or professionally. So just so I can get a sense of who we've got with us. I also know some folks might be caregivers of older family members or other people. So I'm curious to know about you all too. And some of this will probably apply to you as well. But really interested to see who we've got with us.
About another moment, and then we're going to end the polling. So please submit your answer. Okay.
All right, I'm making you work straight off.
There we go.
All right. All right, so about half and half. For those of you who aren't caregivers of children or adolescents at this time, I still think you'll learn a little bit something that might be helpful to you. And a lot of the presentation in terms of creating more harmony is also about self-care and creating a safe space for yourself. So I hope that that'll be something that's useful to you as well. And now you can switch to the next slide for me. And I've got one other polling question. And since some of you aren't caregivers, feel free to just fill this out if you've experienced any of these feelings at all during the coronavirus pandemic. All right. Probably have experienced all of them at one point or another. But curious to see how folks are feeling.
About 54% have voted.
Okay. And thanks for participating, guys. I'm used to lecturing to big classes and forcing people to engage, so you won't be subjected to that, at least until the Q&A. But I do like to get a sense of who I've got listening. So thanks everyone for participating.
Okay, so we're at 66%. So that's good.
Yep, sounds good.
And
All right. All right, unsurprisingly, the most commonly endorsed one here is anxiety. A lot of frustration, which goes along with anxiety, and some sadness, which is also something that's been common. I'm glad somebody endorsed hopefulness, but happiness and hopefulness have been, I think, harder to come by these days just because of what's going on. So thank you very much for voting. And I'm unsurprised to see that everyone is kind of dealing with some anxiety. And that's probably the thing that I'm going to talk the most about in terms of parenting. So you can switch to the next slide, Christine. If you haven't heard anything about it, I think it's been more in the news now that there's almost a mental health crisis that's going along with this public health crisis. People are experiencing a lot of stress, primarily anxiety, depression, and other things. So it seems like what we need to do is understand how these might be influencing us and think about some ways that we could improve some of these outcomes. So from the literature, we know a lot about stress. We know that it leads to poor health outcomes, both in the short term and the long term. So higher heart attacks, ultimately people that experience high levels of stress might even die a little bit earlier, decreased functioning. Executive functioning, which you can imagine is really important to being a caregiver or a parent, being able to plan and decision make and all the things that your frontal lobe does. And recently, I think a few years ago, there was a really popular book called Scarcity that kind of introduced this idea that we have a limited amount of resources to deal with regular everyday life stress. And that's leading us to have this experience of limited bandwidth. So when you think of the word bandwidth, you probably think of the internet and that, oh, I don't have enough bandwidth to run this Zoom meeting, or I don't have enough to download this thing, or while I'm downloading this, I don't have enough for something else. And stress can be really similar to that. So when you have a significant amount of stress, it causes you to have limited resources to cope with other things that are happening in your life. Now, as a caregiver, this is especially poignant, and there's a special kind of parental stress that researchers have studied and know about, but it can really impact the way that you kind of live your day-to-day life. So not only physically, but also emotionally and how you're coping. So you can see how stress has a huge impact on how things are going for you. You can go to the next slide there, Christine. All right. So not only do caregivers experience regular stress, but during the coronavirus pandemic, we're seeing a lot more of this limited bandwidth to just deal with things that are happening at home, at work, which for many working caregivers also means you're working at home. And some of you may be going to work outside of the home, but now don't have school or something else to rely on. So a lot of these other stressors are coming up that were always stressful, but never stressful at this level. And now we've got a couple of things that we already know as a mental health professional. I know there are things that are risk factors for families already, but now they're especially hitting families that already have these risk factors even harder. So number one on that is financial instability. A lot of people have either lost their jobs or are not working at stable jobs or having to find these creative solutions to pay the bills. And there's a limited amount of resources for those families. There's less options for childcare. And now any of you who are, just like Noelle mentioned at the beginning, also kind of balancing being a teacher and helping with teleschool for your kiddos are having a harder time getting any childcare or support in that realm. And those with younger children have to decide if they want to send their children to daycare. Some of them are open, if they can afford daycare, if they've lost their job. So it's just becoming a lot more complicated. There's also this anxiety, just like all of you reported, around COVID and the pandemic in general. So as human beings, we don't like uncertainty, and we've been living in this state of uncertainty for a long time now, and there's really not an end in sight. I think we're all hopeful about a vaccine or some promising treatment options, but we really don't know when that's going to happen. So we're constantly in the background of our brains every time we go somewhere, adjusting to the new normal of wearing a mask, worrying about what would happen if I got sick and I have someone to take care of, worrying about family members who are maybe sick or that they could be sick, or some high-risk folks in your family. So this is contributing to that stress that's just constantly running like a program in the background of a computer and making you a little bit worried about what's going to happen in the future. If you're a parent, you're also kind of probably worrying about how things are going to go for your kids. So you're worrying about what all of this is kind of, how this is impacting them when they're small developing brains, and worrying that maybe you're not doing things well enough to kind of meet their needs. So you got loneliness, isolation, financial instability, and now these expectations to be everything at once, a parent, a teacher, working. And with the age of social media, everybody is just constantly comparing themselves to how other people are doing, even if those pictures aren't really accurate. I've had a lot of just personal friends reach out to me and say, I don't know if at the beginning of the pandemic, we're saying things like, I'm not going to let my 2-year-old watch too much TV, but a few weeks in, now he's watching it all the time and I feel like a bad parent. This other mom who was a preschool teacher now has all this whole day organized, and I feel like I'm having a hard time just coping with the day-to-day of raising my kids. So it's just hard to not feel this, even if it's self-imposed stress. Yeah. So you can go to the next slide for me, Christine. So we know that before the pandemic, things were stressful, but it was a different kind of stress, and most caregivers were experiencing what we'd call this transient stress that kind of ebbs and flows over time. So maybe you've got a project due at work and your kid's not sleeping well at night, and so for a week or two things are really stressful, but then that goes away. And typically this kind of stress is not really characterized as burnout because it's something that doesn't impact our long-term kind of family health and wellness. But there are a lot of caregivers who experience what we call burnout, which is a real thing that's been studied. And that's where the stress and everything that's been piling up is getting to a point where it feels like too much. And that can lead caregivers to act in different ways and lead to poor outcomes, both for them and for their children. So now that we've got COVID, the typical balance that we have of normal risk and protective factors is off. You might not have your parents or grandparents around to help with the kids. You might not have the same social support that you did before. And again, you're maybe struggling with being able to afford childcare or a little bit of relief during the pandemic. And we know that parenting stress specifically does a couple of things. And so I want you to see that this is kind of a cyclical factor. So you feel this sense of lower self-efficacy, or, hey, I feel like I can't be a good parent, or I'm not a good parent. I can't do it. You might be more likely to yell at your kids or punish your kids or do things that maybe work in the short term, but long term create more behavior problems or difficulties. And we find that the kids react to that with having more stress of their own or behavior problems perhaps. And these folks that are experiencing high levels of parenting stress are less likely to actually engage in mental health services or seek help. So they create this kind of cycle that doesn't really work, but it's functional enough to keep going. And it's potentially really problematic, both for your health and wellness and for your kids' health and wellness. Right. And now I've talked about all the doom and gloom about how caregivers are really being impacted. I want to talk briefly about life changes in kids around this. So this graphic here is just from the CDC, and they do kind of some regular polling to just look at frequencies and how many kids or parents are reporting these issues. Behavior disorders are most common, especially in the school-age kids. Anxiety is pretty common in the older ones, and this is without the pandemic. So we already know that about 1 in 6 kids are affected by mental health, but it could be higher at this point, and I suspect as things go on, we're going to get a lot more data from the CDC and from other researchers that these mental health issues are going to be significantly higher as a result of what's going on. So there's a lot of potential reactions that kids might have. It'll be dependent on a child's specific age and what maybe their personality is already like, or what their life situation is like. If they have other risk factors, they might be at higher risk, and kiddo's age. So a teenager might be a lot less likely to have disruptive behavior problems, but might be more likely to experience a little bit of depression or anxiety. Okay. But I don't want to say all of that and not remind you and not say that kids are really resilient. So the good news about this, a lot of studies that have been done since, there was a very famous study called the ACEs study, and ACE stands for Adverse Childhood Experiences, that looked at how ACEs have an effect on children and their families over the lifetime. And there was a lot of research that came out on resilience as a result of that, and saying that there are a lot of things about kids that make them really resilient. And most kids have some protective factors in how that they respond to stressful situations or to trauma. And the most important thing is that they have one safe, stable, supportive, and consistent caregiver. So that's the strongest factor. And they are resilient to things when it comes to taking the cue from you. So if you're kind of modeling and setting an example of how we should respond to the things that are happening in our world, even if it's hard, even if you have to kind of put on a brave face in front of them and then later talk to an adult about what's going on with you, they will respond in a similar way. So the more that you can be kind of factual, share things with them in an honest and developmentally appropriate way, and show them through your own actions how to handle tough emotions and things that are going on, the easier it'll be for them. Okay. So now we're through kind of the everything that's going wrong with coronavirus. And I want to talk a little bit more about what are some specific strategies that you might try or that you might share with other parents and caregivers in your life about how to create an environment that's more harmonious or happier in your house. And the first way to do that is to just take a deep breath and say, it's going to be okay. So lower the expectations you have about being a perfect parent. Remember that as human beings, we are imperfect. We don't make perfect decisions. And especially as parents, being a parent is really a process. So day to day, it's not going to be necessarily easy. It might be harder. It might be that one day is really great and the next day your kid feels like he was abducted by aliens and is someone new. But we're not going to be perfect at it every day, and it's okay to make mistakes. Especially now, we're living in a time that's unique, that's different than anything we've ever seen before, and we're all kind of adjusting to how that new normal is impacting our lives and our functioning. So try not to be too hard on yourselves is the first thing I would say. All right. And really really strive to take care of your own emotional needs and your own health. And what that really means is learning how to take care of yourself. And I know that most, especially women, female caregivers have this responsibility to be the perfect mom who's there all the time, who's emotionally available. And it's just not something that we can do all the time, especially as you have all these things running in the back of your brain about COVID and stress. But you can ask yourself a couple of questions to see, where am I at right now? And how could I feel stronger or more capable or more supported? And think through some ways that you could physically or emotionally reach those goals. That might be enlisting the help of someone. It might be saying, hey, I really need to stop looking at my phone every 30 seconds. There's also a lot going on in our country beyond coronavirus with the politically that is making a lot of people react in a lot of different ways. So being able to kind of take a step back from that, or limiting technology, or taking a mental health day could do a lot to kind of improve your emotional needs and health and well-being. Also learn about mindfulness and practice mindful moments if you can. And that could just be knowing if you have back-to-back meetings or you're expected to be a lot of different places, take a minute to walk outside and appreciate the sunshine. Take a minute to really enjoy that first sip of coffee in the morning. Anything that you can do, even if we are now constrained by physically having to be at home or having our kids around us all the time, to give yourself a safe space to kind of express all the things that you're feeling, or appreciate the other things that are going well in your life can really help. And if you need help, ask for it. Ask a professional, ask your doctor, ask somebody different ways that you could maybe establish or grow a new support network for whatever is going on. So just knowing yourself and knowing how to take care of yourself can be a huge and important thing, not only for taking care of your kids, but for modeling for your kids how to handle a tough situation. All right. And this is something that is for everyone, not just caregivers, but anyone who's now experiencing the pandemic is likely experiencing some heightened stress and anxiety. So self-care is probably something you've heard about. And I think that a lot more employers, a lot more people are kind of embracing this idea that we need to take care of ourselves. And how can we do that? Be physically healthy and well. I realized about two or 3 weeks ago, I was just sitting so much being on Zoom meetings that I got a desk on Amazon that helps me to stand up. I started doing a couple of my less formal meetings, walking outside if I could, anything that you can kind of do to help yourself stay physically healthy and well. Eat well, try your best to get a good sleep routine going. I know it's hard. And try to spend time outdoors if you can, if that helps. There's a lot of different ways that even with the pandemic, you can exercise in a socially distant and healthy way. And I would encourage all of you to do that. And really try to make time for yourself. Take a bath, for younger kids, I often say, have a calming corner that's both for grownups and for kids, where if you need a break, you can take one and step aside. And just be kind to yourself again. And remember, take that deep breath and forgive yourself. Okay. So how do we support our kids also who are experiencing any of these issues? Know when you need to take a break. A lot of the parents that I've worked with of younger kind of preschool age kids will say, sometimes I feel like I respond exactly the way to them that they respond to me. So if they're not listening or they're throwing a tantrum and you're finding yourself yelling and tantruming back, that's the time to model to your kid, I'm angry and I need to take a step back and see how I can handle this in a different way. And I'll come back and we'll talk about it when we both calm down. So if you model how to handle those tough feelings and acknowledge for your kids that it's okay to feel that way, it'll make it easier for them to come to you when they want to express them in whatever way they can. And another empirically validated, very evidence-based strategy that's used in almost every child, even teenager therapy that I know of, is just spending one-on-one time where the child gets to pick the activity and the child gets to lead in the play. Focus more on that and being present socially and emotionally and working on their health and wellness in that way, and less time trying to spend every moment as a teachable moment. You don't have to read books any one way. You don't have to do any particular game the way it's meant to be played. What's more important is that your child gets a sense of control by being able to lead or at least choose the activity. And for young children and for us as adults, sticking to your routines can be really helpful. So the more that you have a regular routine, the easier it'll be for everybody in the house to kind of have some harmony. And also practice positive parenting, which I don't know how many of you have heard this. It's another strategy. There's probably, gosh, tons of interventions geared around what positive parenting really is. But we know from the research that praise works a lot better. Positive reinforcement works a lot better than negative reinforcement. So the more you can praise your kids or your husbands or partners or whoever else specifically on the things that they're doing well. Thank you so much for emptying the dishwasher before I asked you. That really helps me later in the day. The better you're going to see those behaviors more frequently. So you want to try and catch them being good rather than yell or discipline or redirect them when they're being maybe not as good, or you're seeing troubling behaviors, because inadvertently, when you're thinking about the function of any child behavior, most of the time it's attention seeking. So negative attention is just as reinforcing as positive attention, but the difference is that positive attention will help them to get those behaviors to happen more frequently. Also, if you have a younger child, tell them what to do instead of what not to do. So using that sort of different language when you maybe give a command or ask them to do something, it's saying, don't do that, don't do this, is not as instructive as saying, please put your shoes on, let's go to outside. Whatever it is that you want them to do specifically, you're gonna get them to do it more often if you can be very clear and specific in your language, right? Also know what's sort of age appropriate and what your child is capable of doing. So I've had a lot of parents of kids who say something like, you need to go clean your room. A child goes up there and is like, I don't even know where to start. But if the parent says, I want you to pick up all the trash and throw it away and then make your bed, that's a very concrete, easy thing for them to do. And they have a little bit more clear direction about how they're supposed to be doing it. So when a young child feels frustrated, know how to model being calm, cool, and collected and talk through those feelings. Differently when a teenager's frustrated in a different way, maybe help to validate those feelings, really listen and be present, and engage in creative problem solving about ways that you can help them still see their friends in a safe way during COVID. Right. Here's some resources just on positive parenting. If anyone's interested, I wanted to pop them up there. The CDC is great tips for all ages. And if you have a younger kiddo, 0 to 3 has a ton of great resources, including an awesome text service that they have where they just text tips about development and where your child's at. And there's a lot of good information there, both about that and about managing parenting around COVID. Okay, go to the next slide. I also threw up one of my favorite tools in therapy is the anger thermometer or the feelings thermometer. So I've put 2 examples of these here. And this has helped me with a lot of both frustrated parents and frustrated kiddos, knowing how to express where they're feeling on the thermometer and knowing kind of what they're capable of in that moment. So we want to catch them in those lower moments when they're feeling great. But knowing when they explode or they get to the point where they're kind of out of control, that's where you need to help them to calm down before we can come back and talk about it and process. So these kind of visual tools, especially for younger or school-age children, can be really helpful now, especially if your home is not only home, but also school. You can find lots of great resources like this on the internet that can help you kind of manage those social, emotional, or really strong feelings that little kids have and help them recenter. Okay. And arguably the most important thing is just to really be present in this moment. Find as many ways as you can to connect with others and excite your kids with new routines and experiences during this time. So the more that you can look for the positives and find things that you all can do to sort of redefine your life within what you can't do with COVID can really help show your kids kind of like how to make lemonade out of lemons. So there's a lot of great tips on social media. You can join a lot of different groups and tons of resources from local museums. The Delaware Children's Museum now has a great kind of weekly craft that they put up, and they do readings of stories at the Natural History Museum. So you can find some interesting ways to kind of keep your kids entertained or maybe find something that's really relevant to their interests. I also know there's a live safari from Africa every day that I sometimes pull up while I'm working just to remind me that there's a world outside of my window. And you can also create some new or exciting home traditions, like a family game night or even cook together. And remember that things that are maybe really simple or seem silly to you might be really, really interesting to an 8-year-old who's never really done that before. So think of some things that you maybe used to do a lot, or projects around the house that are age appropriate that a kid can help with, which might help you out and also might make life a little bit easier for you. So get as creative as you can. All right. And the final thing I want to talk about is, so these are kind of the things that I've presented are really some basic tips for how you can kind of maybe work on if there's mild behavior problems or other small issues going on, or just the normal amount of stress that we're all experiencing about coronavirus. But I want to talk about when maybe it's time to reach out for a little bit more help. And the main way that I always tell people is to think about whether whatever the issue is significantly impacting your life. Is it stopping you from parenting the way you'd like to? Are you having some symptoms that are making you so depressed or anxious that it's impacting other people, causing stress at work or in your relationships? Or your child's difficulties making it impossible for you to feel like you have a handle on things? I had a parent who said, I knew it was a problem when I woke up and dreaded seeing my kid, and I needed some help to kind of support how to manage his behavior problems. So really think about if it's reached a point, or you have families in your life that you think are really struggling, then you don't have social support or other support. Definitely there are resources that can help, especially even during this time. And always, if you're worried about developmental milestones, or if you have a child who's really aggressive, that's never something to ignore, and you can absolutely get some help and resources from the community for that. You can ask your doctor or your pediatrician. That's someone who can help you. There are a lot of doctors, especially in like the Nemours system. If you take your kids to any of the Nemours clinics, there's usually a psychologist who is there and is embedded in services there, and may even be able to talk to you while you're there. You also can get a screening done by your doctor, who may be able to refer you somewhere. Or you can use some of Delaware's many resources. Here in Delaware, you can call 211, and there's also a special subset of 211 called Help Me Grow that's for younger children. They have a service that's wonderful and no one ever talks about it, called Intensive Family Consultation, where you'll get assigned a consultant who will actually help you get connected to resources and services and things like that in the community. And there's a lot of things on Delaware's Mental Health Delaware website, and as well as DuPont, who has a tremendous amount of behavioral health resources. Their website also has a ton of great worksheets and activities and things for parents if they're concerned about some aspect of their child's development. And if families are in crisis, there are also a number of great crisis resources in Delaware. Mobile Health is one, and I can pop these into the chat after I'm done my presentation just to have them. There's also a text line for adults. So if you're having a really difficult time or feeling depressed, you can text someone and they're available 24/7 to text you back. I know a lot of people have a tough time maybe picking up the phone or accessing services that way. So that's something that Delaware has that's really tremendous, and they can help you get linked with services that way as well. And also right now, another one of my roles at the university is to supervise the graduate students at our Psych Services Training Center. And they currently have a free brief telehealth service that's available to really any adult in Delaware. That's only about 4 sessions, and it's designed to kind of jumpstart if you have a little bit of coronavirus, stress, or anxiety. You can get services within those 4 sessions. And if you need something more than that, or this is opening up you needing additional therapy, they can provide a referral and support through there as well. And I'll put the information for them in the chat as well. Okay. And finally, I just listed some additional resources for folks about talking about coronavirus, some other information about specific parenting issues that are going on now. So just some helpful resources if anyone wants to learn more. Okay. Some of the references for the things that I mentioned, and now if anyone has any questions, I'm happy to answer them.
Thank you, Dr. Haupt, for that presentation. We appreciate that very much. And we do have some questions coming in. So again, please do put your questions in the Q&A box, and we can address those here momentarily. One of the questions we have is, do you have any suggestions for managing online learning?
Sure. Yeah, that's been the number one question on everyone's mind right now. First, I would say to take a deep breath and remember that your child will be okay if they don't ace all of their virtual tests, or even if they aren't able to really fully attend. I have a hard time attending to meetings that are longer than about an hour. So I think we have to be realistic about what our kids can handle. And the things that you're going to want to do with your children, you are the expert on them, so you probably know what's going to work best for them. They might need a little bit more structure. You know, a lot of kids need those. You can't see me, but I constantly talk with my hands, and I like having things in my hands, and I've always been that way. So maybe even having a little sensory or tactile things could help a child to attend a little bit longer, or giving them little brain breaks, which I know they do in school. So in between, have a little dance party, watch a brief YouTube clip, which I know every other kid I talk to in therapy now is going to be a YouTube celebrity. So anything that you can kind of do to keep them engaged, but also recognize that, hey, they're not going to be able to attend the same way they would in person and at school. So be flexible is the short answer to that.
Great. Next question. What about kids being socially isolated? Are there short or long-term consequences of them not seeing other kids?
Yeah, and there's kind of a couple of schools of thought on that, but getting back to kids being really resilient, now we live in an age where connectedness it's not the same as being in person, but there's so many ways to be connected to other children via social media that I think it's less of an issue than we think. I think parents are more concerned about it than kids are. And there are also ways that you can stay connected and that you can physically be present. I had a friend who was outside, took their kids outside, and they drew big circles and said, this is our family circle and this is your family circle with the neighbors. They were well beyond 6 feet apart, but they were able to play and talk and kind of do chalk and things like that together in a socially distant way. Now that it's fall, we can go hiking, we can be outdoors for probably a little longer periods of time. So the more you can get creative about it and kind of know what you're comfortable with as a parent and how you need to set limits, but also know how to be kind of flexible and creative and allowing kids to see each other. They might even find that this time they'll think fondly back on having you home more, having some cool, weird experiences they'll be able to talk about with their own kids. So try not to worry too much about that.
Great. And this one follows up well. How can I handle my kids asking questions about what other children are allowed to do during COVID if I don't agree, or if we as a family are doing something different?
Yeah, that one's come up a lot too. It's tricky to know how to talk to your children about these things, but I think always being honest, straightforward, and while validating their feelings is important. So you can say, I understand that must be really hard and it doesn't feel fair. And there are a lot of things that are going on right now that just aren't fair. So we have to do what's best for our family, and your dad and I are in charge of that, or my partner and I are in charge of that. And what we've decided is best is to do this. So that might be different than what another family has decided to do best. And it's tough to hear, but validating their feelings and again, offering some kind of compromise or some way that you can do something similar that you feel comfortable with is probably the best way to address those types of questions.
Great. I have one final question, unless I get any more questions in the box here in the next few minutes, is my partner and I disagree about what risk we are comfortable taking when it comes to our kids. Do you have any suggestions for how to handle this?
Yeah. All right. So any kind of conflict that you're having with your partners is also very related to everything that I've been talking about in terms of stress and anxiety. And I'd say the same thing. The truth is, anything that I'm telling you to do with kids is also very relevant to do with adults in your life, especially around validating feelings and helping somebody else feel heard and listened to and respected. And pretty much everything that we're doing around the pandemic right now is deciding what calculated risks are we willing to take, or what is the benefit of this risk and how should I engage in that? So I think that having kind of constructive discussions where people use, if you look up fighting fair, use I statements and talk about why you feel the way that you do and try and reach some kind of a compromise is the best way to kind of handle that. And again, if you feel like there's a ton of conflict in your relationships right now, maybe seeking out some help to kind of figure out how to manage that.
And I did have another question that came through. This person's child desperately craves connection with his friends. Should we allow him to be on Zoom as long as we would normally let him play?
Yeah.
Even if this means more screen time after being remote learning all day?
Yes, that's a good question. I think that some of that has to do with your personal preference as a parent and what you feel comfortable with. But I think most pediatricians and most other psychologists would agree with me in saying if you think that that's the most healthy thing for your child in terms of their social development and helping them to feel happy and connected, then let them stay on Zoom as long as they need to. I don't think it's also very different to be on Zoom talking or playing with your friends than it is to be doing remote learning or to be just watching kind of mindless cartoons all day. So there's definitely that, again, risk versus benefit. I think that in that situation, the benefits of be able to see your friends, even if it's in a remote way, would probably outweigh the screen time issue.
Great.
That's a really good question.
Yeah, that is a good one. I know I, as a parent, struggle with that one myself. So actually all the children ones that were asked, they were excellent. So thank you. And thank you for addressing those questions. That was all the questions that we had for you, Dr. Hout. And I again want to thank you on behalf of the Mobile Health Program and Partnership for Healthy Communities, for both to you and Dr. Gibney for being here today to present to our community COVID-19 facts and myths, as well as parenting around the coronavirus pandemic. So again, thank you. And to our audience, thank you again for joining us. And I do hope that you will be able to join us next week for our next webinar, which I believe is on telehealth and how to get the best out of your visit with your provider over telehealth. And you can register for that at our website. And also our Lunch and Learn series starts next week. So again, you can register for that one at our website. So we hope to see you next week, and thank you again for joining us, and hope you all are able to get out and enjoy the sunshine that we have out there today. So thank you.